Okay, so maybe you could just start by just telling us what you guys have been doing for the last 20 years. Just give us the basic background and get us up to speed.
I go first.
Yeah. So in 2008 is when I started this whole plant-based journey. Lost my dad to cancer. And exactly 10 weeks after he passed away, I was diagnosed. So that was really the 1-2 punch I needed to get my nutrition on track. And for a couple of years, I tried to figure out, what causes cancer? How do I not get it again? This is a very scary thing. So then in 2011, I started a company called STL Veg Girl, St. Louis Veg Girl, where I was doing classes in grocery stores and schools and doctors' offices and, all libraries, all the places. And got away from that a little bit, started a food delivery company, worked out of a commercial kitchen. So it did a lot of things during the years, trying to figure out this whole plant-based business. And I was also working in, I was working at an anesthesiology practice also. So that was like my day job. So I was doing this STL Veg Girl kind of thing on the side. And in 2014, I left my corporate job because STL Veg Girl was doing much better. And people here in St. Louis, Missouri were like, oh, what is this plant-based diet? I kind of get it now. So I was getting a little more business. Then in 2017, I had my Food for Life certification. I went through Cornell University for plant-based nutrition certificate. I went through Well Coaches for the health coaching. And I was doing a lot of classes, a lot of cooking classes. And I was starting to see some people who had reversed their type 2 diabetes, reversed their heart disease, their PSA levels went down. They were really starting to heal themselves just by putting more vegetables or plants on the end of their forks. But then I would see a few people who would just slide back and they would start adding in the foods that got them in trouble in the beginning. And then, of course, they were getting sick again, right? They were back on the meds. They were spending all the money on the meds. They were just not at a good place. So I was thinking about this one night and I thought, I wonder why somebody specifically who does take control of their health, change their health outcomes, why would they then go back into eating those foods? So I put on my health coach hat and I thought, I think that it's support.
Right.
I think that, unless you have support around you, you're going to go back into those bad habits. So, and when you change anything in your lifestyle, maybe you want to stop drinking so much or at all, maybe you want to quit smoking, maybe you want to exercise more. It's easy to find support for those kinds of things. Yeah. But when you want to change the way you eat, oh my gosh, it's a solo mission 100% of the way. And you have to be an expert, right? So I was seeing a lot of people that I personally saw a lot of people go back into their old habits of eating because they did not have the support. So I thought, we got to create it, right? So I contacted some people who I know in this plant-based arena that are, pretty well known, and I have the sincere pleasure of knowing. I called them separately and I said, listen, I'm thinking about opening a brick and mortar support culinary school, something for just plant-based living or plant-based eating. I said, do you know of anybody in, I don't know, like Berkeley, California, or Brooklyn, New York, places that are, really progressive? Is there anybody who has just solely a plant-based educational facility? And they both said no, because they're doing what you're doing, Caryn, which is what we were all doing at the time. And we were service-based. We were going places to spread the word about plants. And I thought, well, that's just silly, because if somebody's really sick or they need to find support, we cannot be moving targets. We've got to have a place. So that was 2017. So in 2019, so I saved everything I had for 2 years. And 2019, the anniversary of my dad's passing, August 13th, we opened up the nation's first plant-based nutrition and culinary education center, the Center for Plant-Based Living, which is where we are coming to you from right now.
Right. And, Caryn and I met. So my journey, it's interesting to me how many people I know, professionals, physicians who came to lifestyle medicine, plant-based nutrition through their own personal health issues, including myself, right? So, I trained here in St. Louis at Washington University, and I thought I was a pretty smart guy, but I just kind of would my perception of what a healthy eating was regurgitating the food pyramid, right? Low fat dairy, lean meat, fruits and vegetables, whole grains, and don't eat too much ice cream. And found out, unfortunately, in 2010, 2011, that you can't outrun a mediocre diet, because after a knee injury, I had to wait a few months to get surgery because I was really busy, and I started to gain weight, and then I didn't do the rehab after surgery, and I gained more weight. And next thing I know, I was a patient. I actually went into atrial fibrillation, and it turns out I had undiagnosed sleep apnea that came on because of the weight gain. And I finally went and saw my doctor, and my cholesterol's through the roof. I got borderline diabetes, I got borderline blood pressure. And, I'm seeing friends of mine that I trained with, world-class docs here in St. Louis. No one ever had a conversation about lifestyle. It was CPAP machine and antiarrhythmics and statins. And, I knew where I was headed because I was in my early 50s at the time. And, I was on the trajectory that almost every single one of my patients was on. And one day I was laying on the couch and I stumbled across Forks Over Knives, the documentary, and thought, wow, food is medicine. Who knew? So made a commitment that summer to go on to transition to a plant-based diet and rehab my knee. And probably 4 or 5 months later, I had lost 40, 50 pounds. My cholesterol dropped 100 points. My atrial fibrillation went away. The sleep apnea went away. I'd had lifelong allergies and asthma. That all went away. I could exercise again. And so, obviously, you realize pretty quickly if what's good for me is also good for my patients. So I really started to transition my practice to more of a plant-based lifestyle medicine, focusing on plant-based diets. And Caryn and I actually met at the very first plant-based nutrition conference in Naples, Florida. And it turns out we were both teaching plant-based cooking classes at the same cooking school and didn't know it, different nights. And so we started to collaborate doing classes. And when Caryn opened the Center for Plant-Based Living, she asked me to be her medical director. I actually relocated. I moved in the end of 2015 to Washington, D.C., where I now live. And I'm to serve as the medical director for the Barnard Medical Center, which is, I think Dr. Barnard spoke the first day of your conference. And it's a lifestyle medicine practice with a focus on plant-based nutrition primarily. And so, and once you have this knowledge as a physician, and once, you have as a chef, we can't unhave it, right? And we both feel it's so important to stand on the top of every mountain and share, what we've learned, so that we can help other people, regain, attain, and sustain their health.
Great. Thank you. So I guess the question is, I've been interested in plant-based nutrition for a long time. We've had the Real Truth About Health. This is our 10th conference. And we've had a lot of great speakers, and I think it's really great. I'm very excited. I like all the wonderful speakers. They're really smart. They have great resumes. They're, went to great colleges, and I'm totally sold that this is a great way to go. But we're trying to be genuine here, and we're trying to be the real truth, not propaganda. So when I look on the internet for speakers for our conference, I find that along with all these amazing plant-based people, there's a bunch of people screaming their heads off about the keto diet, the paleo diet, eating animal products. And even though I feel like I've learned a lot, I'm thinking maybe I'm not an expert. So in the real world, with your real patients, with the real people you deal with, what is actually happening? Is everyone who adopts a whole food plant-based diet thriving? Are people still, compared to people who are doing the keto diet, like what's really happening in terms of obesity, cancer, heart disease, and not just after 3 weeks, what's happening 20 years later? Like, do we know anything about what really is happening in the real world with people who eat a whole food plant-based diet in terms of their health outcomes compared to not only the standard American diet, which we know isn't so good, but like a keto diet where they're also giving up processed food and white flour and sugar, but they're using a lot of animal products. Any thoughts on that?
Well, I'd like to start with just saying, I know that especially in this world of everything, you can get all the information right here, right now. And that's what we all want. And I will tell you that a plant-based diet, a whole food plant-based diet, no to low oils, all those things, it is the most progressive and yet the most conservative approach to regaining very, very good health. Now, here's the thing. So Jim and I are actually on staff at a health immersion, and we do these couple times a year. And the people who come to this health immersion are very sick. It is health insurance does pay for it. It's actually for Whole Foods employees, but it is incredible to me that so many people who come to this health immersion are so sick. They've been taking type 2 diabetes medications for 20 years or plus. They have just all the chronic illnesses you could ever imagine just piled into these people for years and years. About the immersion is 6 days long. And I'm not kidding you, within probably 72 hours, maybe even less than that, we start to see people pass out. And it's because they are then over medicated.
Right.
Okay. So this health immersion that we do, there's no smoothies, there's no like crazy exercise, a lot of exercise. There's no supplements, there's nothing. The food is all buffet style, and it's all whole food plant-based. Now, it is doctor driven. So there are Dr. Scott Stoll's there, Jim's there, there's some other physicians. But people become over medicated because their bodies start to heal so fast.
Right.
It is amazing. If we give our bodies just a little bit of help, we want to be healthy people. Right. I mean, we all know of functioning alcoholics and people who are, on drugs, and they're, functioning parts of this society. But if you give yourself just a little bit of help, it's amazing how fast your body will take over, that health will take over. And Jim can even, Jim's going to have it ton more to say, but he can really talk to what's happening down the road years later.
So Steve, I think that, a couple issues you bring up that are important to understand. So first of all, when we look at evidence, because I practice evidence-based medicine, we everything we do at the Barnard Medical Center, everything we do in our classes here, the information we provide is evidence-based. And as you well know, nutrition research is notoriously difficult to do. You can't do the kind of the gold standard double-blind controlled study, because you can't take small children and put half of them on a plant-based diet for their whole life and the other half, standard Western diet, and see what happens. So we know in many ways we have to rely on population studies and things like that. And the other problem is where does when we look at studies, for example, with type 2 diabetes, and that shows that metformin, makes your diabetes better, who's funding that, right? What's the pharmaceutical companies? There's no big blueberry that's out there funding research to really take a hard look and generate hard science, oftentimes around the benefits of plant-based diets. Now, that doesn't mean it's not out there. PCRM actually is Neil's been one of the leaders in research. The PCRM has a research department. They've done a lot of really foundational work looking at type 2 diabetes, for example. But there are lots and lots and lots of studies looking at, for example, Dean Ornish's work around prostate cancer, that, when you go on a plant-based diet, your PSA levels go down in a profound, what's called epigenetic effect. They were able to show that over 500 prostate cancer promoting genes turned off. You look at Ornish's work, I think the speaker before this came up, Ornish's work on heart disease reversal. Some of Neil's work comparing plant-based diet to the standard ADA diet for diabetics, on and on and on. So there's a lot of emerging evidence around autoimmune diseases. So there is a growing body of evidence. And I think the problem is, though, and the challenge, and one of the things that Caryn does a great job with, and we're both trying to accomplish, is I think what makes this so hard for everybody, eating is a learned behavior. And once we learn it, we just stop thinking about it. And it's kind of like driving. Driving's another example of a learned behavior. And once we learn how to drive, our brains stop thinking about it. And there's an evolutionary reason for that. And that's because if we had to think about everything we did, we wouldn't have seen the ripe berries, and we wouldn't have seen the leopards, and we wouldn't have lasted very long. So our subconscious brain automates tasks pretty quickly. Eating being one of those, but driving is another. So, you get in your car, you don't think about putting on your blinker, your brake. You move to London tomorrow, you got to learn how to drive on the other side of the street, right? And it's going to take 3 to 6 months of really focusing on the new behaviors you have to have. What side of the road am I on? How do I go through the roundabout? And then one day you get in the car and that's how you drive. And you wouldn't drive on the wrong side of the road in moderation, now would you? No, right? Because you'd only have a moderate number of head-on collisions and run over a moderate number of pedestrians. So the problem is with diet, that head-on collision, that heart attack, that stroke, breast cancer, colon cancer, that head-on collision might be 5, 10, 20 years down the road. And so it's very hard sometimes for people to stay focused long enough to develop new habits around healthy eating and healthy lifestyle so that to avoid that head-on collision. And so again, what Caryn's trying to do at the Center for Plant-Based Living, what we do at the Barnard Medical Center, is really work a lot on behavior change. We don't need any more research on what's the best diet to lose weight, prevent diabetes, reverse heart disease, et cetera, et cetera. That there is a solid body of evidence out there that we know that at least a plant-forward diet, and most, whole food plant-based diet is the optimum diet.